All right, welcome to The Explainer. Today, we're jumping into two medical terms that sound kind of similar, but are worlds apart when it comes to what's actually happening in your body: aneurysms and dissections. Now, you might think, why does this matter? Well, understanding the difference isn't just for medical students. In the world of our blood vessels, it can literally be the difference between something doctors can manage and an absolute life-threatening emergency.
So let's just get right to it. If I asked you right now, what's the difference between an aneurysm and a dissection, could you nail it? If you're hesitating even a little bit, hey, that's totally normal, and you are in exactly the right place. Stick with me, and I promise, by the time we're done here, you'll get it.
So, here's our game plan. We're going to start by picturing the body's high-pressure highways. Then, we'll zero in on that core difference, aneurysm versus dissection. After that, we'll dive into the different types and where they pop up. We'll talk about what they feel like, think whispers versus screams. Then we'll see why it all becomes a frantic race against time, and we'll wrap it all up with the key things you really need to remember.
Okay, first things first, let's set the scene. I want you to picture your circulatory system, specifically your arteries. Think of them like a massive, complex network of high-pressure pipes or a highway system that's constantly pumping blood from your heart out to, well, everywhere else.
Yeah, this system is under incredible nonstop pressure. And just like any high-pressure pipeline, if you get a structural failure, say a weak spot that starts to bulge, or a tear that lets things leak out, you've got a recipe for disaster. Aneurysms and dissections, these are basically the two main ways that failure can happen.
And that brings us right to the heart of it all. The core distinction. You know, these two words get thrown around and used interchangeably all the time, but they are absolutely not the same. And in medicine, getting that difference right is everything. Okay, here's the single best mental picture you can have for this. For an aneurysm, think of a weak spot on a car tire that starts to bulge out. See it? The wall is still there, it's intact, but it's ballooning outwards. A dissection? Totally different ballgame. Now I want you to imagine the layers of that tire wall actually splitting apart from the inside. So one's a bulge, the other's a split. That's it, bulge versus split.
So let's put the official medical speak to that. An aneurysm is a localized abnormal dilation of a blood vessel. The key words there are weakening and dilation. Basically, the wall gets thin, it stretches out, and it creates that balloon we were just talking about from our tire analogy.
A dissection, on the other hand, is way more complicated. See, your major arteries have layers, kind of like plywood. A dissection kicks off when the super smooth inner layer, the intima, gets a tiny tear. Then, high-pressure blood forces its way into that tear and starts peeling the layers apart. This creates a new, really dangerous channel for blood inside the wall of the artery itself. And that's what doctors call a false lumen.
Let's walk through that scary chain of events one more time. Step 1. A little tear happens in that smooth inner lining. Step 2. The full force of your heartbeat pushes blood into that tiny opening, prying the layers of the artery wall apart. And step 3. That creates the false lumen. This new channel basically steals blood from your vital organs and puts the entire vessel at risk of blowing out. It's a total structural failure, from the inside out. Okay, so now we've got the basic concepts down, right? Bulge versus split. Let's add another layer of detail here and talk about where these things happen and the different forms they can take.
Believe it or not all aneurysms are the same. A true aneurysm is that classic balloon we've been talking about, where all three layers of the artery wall stretch out together. But a false aneurysm, that's a different beast. It's more like a contained leak. A hole is formed in the artery, but the bleeding is being held back by the surrounding tissue. You see this happen a lot after some kind of trauma or maybe a medical procedure.
They also come in different shapes. You can get what's called a saccular aneurysm, which looks like a little berry or a bubble popping off one side of the artery. Or you can have a fusiform aneurysm. That's where the whole section of the vessel just swells up all the way around, kind of like a sausage. And that sausage shape, that's what we usually see in the most common place for an aneurysm, the big artery in your abdomen, the aorta.
Now, for dissections, the location is literally a matter of life and death. The way we classify them is simple, but it is so important. A type A dissection involves the ascending aorta. That's the massive vessel coming right off the top of the heart. This is an absolute drop-everything surgical emergency. A type B dissection, on the other hand, is further down in the chest, in the descending aorta. That can often be managed with medications, at least for a while.
So, what do these things actually feel like? Well, the difference couldn't be more dramatic. It's really like comparing a faint, barely there whisper to a sudden, horrifying scream.
An aneurysm that hasn't ruptured yet? That's the whisper. Often it's completely silent. It causes no symptoms at all and just gets discovered by chance on a scan for something else entirely. If it gets really big, someone might be able to feel what's called a pulsatile mass, basically a throbbing lump in their belly. Any other symptoms are usually super vague, like a dull backache, or even something weird like hoarseness if the bulge starts pressing on a nerve.
A dissection, that's the scream. The classic textbook symptom is a sudden, severe ripping or tearing pain, usually in the chest or between the shoulder blades. People often say it's the worst pain of their entire life, and as that tear travels down the aorta, the pain can actually move with it. A huge clue for doctors is finding a big difference in the blood pressure between a patient's two arms.
So we know what they are. We know what they feel like. But why does this all matter so much? Because when one of these crises kicks off, it starts a race against the clock where the stakes could not be higher.
And this is where their paths just diverge completely. With an aneurysm, the number one fear is rupture. A sudden blowout that causes massive, unstoppable internal bleeding. With a dissection, yeah, the aorta can still rupture, but there are other horrible risks. That false channel can block off flow to your brain, your gut, your kidneys. And even worse, with the type A dissection, blood can leak backwards into the sac around the heart, squeezing it until it can't beat anymore. That's a condition called cardiac tamponade.
And look, I'm going to say this one more time because it is the single most important clinical point in this whole explainer. A type A aortic dissection, the one that involves the aorta right as it leaves the heart, is one of the biggest emergencies in all of medicine. The mortality rate literally climbs with every single hour that passes. Getting that person to an operating room immediately is their only shot at survival.
Okay, wow, we have covered some pretty serious and scary stuff. So let's bring it all back home and focus on what this all means for you. Let's talk about the key takeaways for prevention and just being aware.
When you look at all the risk factors, there is one that stands head and shoulders above the rest for both of these conditions, and that's hypertension, high blood pressure. It just puts constant day in, day out stress on your artery walls. Of course, atherosclerosis, hardening of the arteries, and smoking are also massive contributors. Seriously, controlling your blood pressure and not smoking are two of the most powerful things you can possibly do to protect yourself.
So if you only remember one thing from all of this, let it be this simple idea. Aneurysms are a weak spot that balloons out. Dissections are a tear that splits the wall apart. A balloon versus a tear. The concepts are pretty simple, but knowing that difference, especially if you ever have to describe symptoms in an emergency, could absolutely save a life.
And that really brings us to our final thought. We've talked about that high-pressure highway system running inside you. So now that you're armed with this knowledge, I want you to ask yourself, what is one simple step you can take, starting today, to help keep those highways of yours safe and strong? Thanks for joining us for The Explainer.